Hello, Fight Insight fans, listeners, viewers. Welcome back. It's Princey D, and with me always, Timmy B. Today we are talking about brain injuries and concussions with our very special guest, Fight On Site, Fight Insight legend. All right. And today we'll also be talking about the UFC's recently released concussion protocol, and then have a very special educated edition of our Fight On Site. It's going to be a great episode. Timmy B, hit it!
Yeah, it's Timmy B, Princey D, Fight Insight. Yeah, that's right.
All right, Prince, we got our guest today. So you may recognize our next guest from our most watched episode to date by a mile, Calf Kicks 101, where he astutely broke down calf kicks, how to effectively utilize them in a fight, and how the damage that they can do. Today, we're happy to have him back to speak about head trauma, brain injuries, and CTE. He's a chiropractor with over 20 years experience, his main focus being the treatment of post-operative patients that suffer from major orthopedic head and spinal cord injuries. Ladies and gentlemen, introducing our first ever repeat guest. He's our resident injury expert, our friend and yours, Dr. Demetrios Jimmy Stavros.
Hey guys, so happy to be back.
Jimmy D!
Hello, buddy.
How you doing?
Hey, I'm great. I'm so happy to be back here, and thank you guys so much for having me back on your show. I love what you guys are doing, and I'm just glad to be back and be a part of it.
Hey, good, buddy. We're happy.
You know what, Tim? I find that whenever there's like a big issue that happens in the UFC, so say somebody snaps their leg or a concussion, we always call Jim in. But when we actually have like personal issues, like, hey, so I've got this burning sensation down there. Jim, do you have any advice?
Off camera, man. We gotta talk about that.
No. We gotta capture it all live. Yeah. It needs to be caught on tape, and just in case anyone else is going through the same issues, we need to have you brought in.
I don't know. It's a PG show, isn't it? I don't know if we can go down that road right now.
Prince, I don't know.
Oh no, PG-13. We'll escalate it. Don't worry.
Yeah.
That's not a problem.
Jim, we're glad to have you back, buddy. We had thought about this topic long ago. After you did the calf kick one, which then you came back on. I mean, we're saying you're the first repeat guest today because this is actually like a Jimmy focused episode. But you came back before when the Jimmy Crute had that terrible drop foot with the calf kick, right? So you did come in to kind of reiterate what you said before. Mm-hmm. This topic today, we wanted to talk about it. This was after the Aljamain Sterling fight, right?
That's right.
And for those of you that remember, or maybe that you don't remember, Aljamain may not remember, but he got a knee to the head. He was a grounded opponent, illegal strike. He flopped and flopped around, Jimmy. And then he was awarded the title due to a disqualification.
That's right.
So a lot of people are like, what the heck? That's not right and all that. But it was an illegal strike, So then we wanted to bring you on to talk about like what kind of damage can someone suffer from, head injuries. Now, you can get it from getting kicked in the head during the fight. You can get it from getting punched in the head during the fight and all those different things. But we thought that it would be a good topic. A lot of people always worried or curious about kind of the damage that they can sustain over long-term physical altercations, right? Like when you're competing in a sport, specifically boxing, right? Boxing even more so than any others. But, you can get these injuries in any way. So we're happy to have you on. And we want the first thing we want to ask is really like, what is a concussion?
So a concussion is a mild traumatic brain injury. So if you can just imagine, you've got your skull. On the inside of that, you've got your brain. And, for all intents and purposes, that brain is the most complex thing pretty much in the known universe. Like this thing is, it's highly structured, highly specialized. It's a highly specialized organ. And it essentially controls every function of your body. But what can happen in predominantly in contact sports and especially in combat sports, you can suffer repeated traumatic blows to the head. It doesn't even have to be, a one-shot thing. You can get concussed when you're sparring even, and that's actually something that can happen fairly commonly. But essentially what a concussion is, it's a mild traumatic brain injury that can happen either due to a direct blow to the head. It can happen to a blow to the face, to the neck, or anywhere else on the body that imparts a force onto the head. And so what that ends up doing is the rapid acceleration and deceleration of the brain within the skull can lead to damage to brain cells. It can lead to altered brain function, and it can also cause chemical and metabolic changes within the brain as well.
Sorry, Jimmy.
Yeah, no
Sorry,
problem.
Jimmy. Is it your phone or Prince?
No,
is your phone going?
No.
Do you have some? All right, one of you two is lying.
No, my phone is definitely not doing that.
I'm hearing something like a it's like a McDonald's order. Like
I was
someone's
hearing
asking.
it too. Yeah.
All right. Prince is pretending it's not him. That's okay.
So I'm on a food cut. I'm actually I'm trying to cut weight. So my cheat meal is not until Friday, so I can have it pushed a little sooner. But that's okay.
All right, sorry, Jim. I didn't want to interrupt you, but because I was hearing the sound, I don't want.
No worries. No worries.
So I'm going to put this photo up too, is what you're talking about.
Yeah, exactly. So that's exactly. So concussions can happen either from a direct impact to the head, like I said. It can even be to the face, obviously. Like if we're talking about combat sports, you can get a concussion from a blow to the neck. You can even get a concussion if another part of your body is hit forcefully, and then it imparts that force to your brain. Your brain gets tossed around within the skull, and even you can get concussed, like from, we're talking about combat, but in military settings as well, concussion blasts can cause a concussion to soldiers or military personnel. So it's categorized as a mild traumatic brain injury. So we're not talking about things that you can physically see on MRI or a CT scan, but there is a trauma to the brain that does lead to symptoms that you developed afterwards as a result of that concussion, a result of that blow.
Right. And so, yeah, go ahead, Prince.
So, Jim, I was going to ask, so, I mean, in terms of like prolonged symptoms, I mean, later on, it actually, some of these symptoms pop up. It's not initial, but later on.
That's
right?
100% correct. Yeah. So you can identify, referees, ringside physicians, and coaches, and as well as the athletes themselves, all of them should be trained to identify the signs and symptoms of concussion, because you can have an athlete that's concussed in the ring. And it's up to the discretion of the referee to decide that, we need to end this fight. In that case, you'll end up with a TKO decision. But you can have a concussion immediately, or you can have symptoms that don't manifest until hours and even sometimes days later. So that's why, there's we can talk about it in more detail shortly, but there are protocols in place that are designed to protect the fighters, even the ones that win. Like, just because you won the fight doesn't mean that you're not likely to also be concussed. But there's protocols that are required for athletes to follow, and their coaches and the medical staff for those athletes to stay safe. But yeah, those symptoms can manifest later, and that's where things can actually get kind of tricky. Which is why they have in combat sports and in contact sports, especially like sports like hockey and football, they have very, very structured and very rigid guidelines on what you need to do in order to return to sport.
And so that's why and I know we're going to get to it, but that's why you hear after a fight, they say, okay, this guy's got a 6-month medical suspension. This guy's got a 4-month medical suspension. And a lot of that kind of goes towards this, right? It's the amount of impact in the fight. And that's why you said, Jim, it doesn't matter whether you win, lose, or draw. You've been taking those shots. You've been getting hit. It doesn't matter that you won the fight. You're still suffering the effects of those hits to the head. And there's all these rules in place to kind of help protect the athlete, right?
Exactly. There's some great information available online, even for anybody who's curious to look it up after this podcast. But the Association of Ringside Physicians in 2018 put together a consensus statement on what they believe the protocol should be in determining what an athlete should be doing immediately after a fight if they've been knocked out. And that's another thing too, like, depending on the sport, if you're talking about boxing and kickboxing, a KO is you're unconscious. That's it. You're out. It's different in MMA, right? So MMA, you can get knocked down. Well, if you're knocked out, then that's it. You're done. But TKOs are different, right? TKOs are technically different as well. But in the event that someone is knocked out, depending on whether or not they've lost consciousness or not, or, it's a TKO or not a TKO, the Association of Ringside Physicians have very strict guidelines that they've suggested on how long an athlete should be out. But the consensus recommendation is that whether you win or whether you lose, if you've been in a combat fight, if you've been in boxing, kickboxing, Muay Thai, MMA, all fighters, all of them that, winners and losers, should have at least a 30-day suspension, or at least abstention from combat, just in case, to prevent the likelihood of there being additional injuries. And this is the thing with concussions. It's not just that you get concussed and you go through several weeks or several months of recovery. What they're trying to do is protect the athlete from some potentially very dangerous and life-threatening conditions. Like, there's a condition that's called second impact syndrome, or you get hit the second time in the head. And second impact syndrome is, it can happen within the same fight, within minutes of each other, or like one after the other, or it can happen in the event of, for example, like football players or hockey players. They'll come off for a shift or the line change or whatever the case is. They've been concussed. It could be even a mild concussion, but then they go back out and then they can get that second impact, and it can lead to a very, very rapid decline in brain function due to intense edema, swelling within the brain, and it can be fatal. It's much more prevalent in younger athletes, which is why it's so important for younger athletes that their coaches and all the staff that are involved can identify the signs and symptoms. But that's one of the reasons, of many reasons, why they need to protect the athletes from concussions, because that's an extreme example of an immediate life-threatening condition. But there's also the long-term implications of repeated concussions, which can affect someone for the rest of their lives. And so,
before we get on to like what are some of those signs and symptoms, Jim, that you can look for so that you can kind of identify that. Mm-hmm. The thing is, like, when we're talking about martial arts, and we all train, or we've all trained before, and for those that are watching and listening, many of you are martial artists that are training. That's why it's so important when you're sparring to not go crazy. You can't go hard. Yeah, you got to be reasonable. Yeah, especially, right? Like, if your goal is, if you don't have a realistic goal of getting to being a professional fighter, sparring with your buddies in the gym and just wailing on each other with no headgear, right? Like, because we've all seen that, but with no headgear, even with headgear, it's not the right thing to do, right? Like, the long-term effects that you can get from being, hit in the head, and it doesn't have to be that hard, right, Jim? Like, I mean,
it doesn't. That's right. You don't even need to be
shots.
Exactly. You don't even need to be hit in the head necessarily. It could be a jarring blow to your torso that can whip your head back and forward. Like, maybe this is an extreme example, but if any fans that are out there remember, Dale Earnhardt, the NASCAR driver, he died because of a traumatic injury to his brain as a result of the accident that he was in. He was strapped in with the racing harness. Back then, they didn't use the Hans device, which is essentially a seatbelt for your helmet.
It ties the helmet.
Yeah, exactly. It's brackets on the side that tie it down into your shoulder strap, so it actually locks your head in place. You still have enough, room to move. But he suffered traumatic brain trauma because of the force of the whipping motion of his head back and forth from the impact. Yeah. So, but, like you said, you don't need to have a lot of, like, a serious blow or even a knockout to be concussed. You can be concussed from successive impacts, one after another, and even sometimes mild impacts. The thing with concussions is they're cumulative. If you've been concussed before, it's easier to get concussed again. And, for the, the weekend athlete, or the person who loves to, hit the gym, practice their Muay Thai, MMA, whatever it is, you need to be aware of these signs and symptoms so that you yourself can protect you, but also your buddies. Like, if you see your friends out there and they're exhibiting signs and symptoms of a concussion, and they're trying to, throw down, even in a sparring session, you want to take it upon yourself to pull them aside and say, hey, listen, this is what I think might be going on. We need to take a look at what you're experiencing here, what I'm seeing, and let's see if we can maybe, keep you from getting hurt.
That's right.
Well, actually, Tim, I just wanted to throw in there, because we're talking about Muay Thai, but also I wanted to throw in my 2 cents in terms of sparring, and even in jits, because I run the same formula as well. Like, I tap out early, like quick. Before any pressure is applied upon me, I tap out. Even when the guy's putting on his gi, I'm like, I'm tapping out. No way. I'm not getting in there. So slight pressure. I remember me and Tim used to roll a couple of times, and Tim, I think Tim like grabbed my wrist, and I'm like, ah, and I'm like, Tito Chino stopped the fight. And he's like, Prince, what happened? He grabbed my wrist. I'm tapping out early.
I was just bringing him into the ring too. Like I was just like guiding him in, and he was tapping.
Yeah, because I didn't know where we were at in the mat, and he's like, Prince, come in the middle. I'm like, tap out. Don't be a hero. Don't be zero. Don't be a hero. Tap out early. So
self-preservation. That's right, Prince. Self-preservation. You got to take care of yourself.
That's it. Being an avid bodybuilder such as myself, to keep this beautiful physique, I need to make sure that I tap out early and jump out early. I thought, sorry guys to interrupt you. I feel like I should have, throw that in there. So go ahead, Tim. What was the next question?
Excellent advice, Prince, to all the young up and comers. Jim, so what are the signs and symptoms? Like you're saying, and I really appreciate that, because you're saying, hey, even when you're in the gym, even if you're training, if it's not you, if you see it in someone else, you got to make those calls. What are those things that you want to look for?
So there's a variety of symptoms that are associated with concussion. And so like things that you want to look at, if the somatic symptoms, so symptoms like headaches, nausea, vomiting, if they're sensitive to light or noise, cognitive impairments. So they have difficulty concentrating, they're developing memory problems. So again, these aren't things necessarily that they're experiencing right there in that moment because they're concussed. That's usually what you'll see, where someone is, knocked out, or they get their bell rung, for, lack of a better word, and they exhibit clear signs of disorientation. That's an indication that someone is most likely concussed. But things that can, symptoms that develop long-term, emotional difficulties, like they can be irritable, low mood, they make difficulty. There's difficulty with eye contact, slurred speech or slowed speech. Their balance is off. They can feel dizzy. Like I mentioned, the cognitive impairments, they might have difficulty reading or focusing or concentrating, and even sleep disturbances. That's another sign and symptom of concussion. So these are all indications that there could be something going on after an athlete has been involved in a competitive combat situation.
Okay. And so when you see those symptoms and when those things present themselves, and if you think that that's you, right? That's why that's why you were saying before about those medical suspensions and things like that. But really, everybody can benefit from understanding what those kind of suspensions are. And so, like you said, the UFC has their protocols, there's other protocols in place. So can you go through, like, what are some of those things that get put in place with those suspensions? What are those? So
things that they look for. So the suspension and concussion management guidelines that were put out by the Association of Ringside Physicians. So if the person is exhibiting signs of a concussion in the bout, the fight should be stopped. This is the responsibility of the referee. And you'll see this happening often in boxing matches. Right. Boxing, kickboxing, Muay Thai, these are sports where the person can get knocked down, get back up, continue fighting. But they can be concussed, and it's up to the responsibility of the referee to make that call to be able to end the fight at that moment. And even, the ringside physician would come in and make that call as well. They can attend to the athlete in between rounds, take a look at them, ask them a series of questions, and then identify whether or not that person the fight needs to be stopped. And again, it's as much as it's frustrating for the athlete, it's for their benefit and for their safety long-term. You don't want to end up with some of the potentially very long-term negative effects of repeated concussions.
Well, and the career limitingness of it, right?
Exactly.
Like if the referee lets me keep taking a beating, right? Then what is that doing for me long term? And that's what they always say. The referee's in there to protect the athlete, right? Exactly. And we hear that and see that. And so, Jim, when you're saying when the ref is checking for it or the doctor, that's when. And again, I know kind of we all know, but maybe we don't. I don't know the medical history of everybody listening and watching this podcast, but that's when you see the ref and they're, in a boxing match, they take their hands and go, hey, and they kind of shake their hands and they're talking to them.
They're actually looking for eye contact too. They grab their hands, they're looking for steadiness in the hands. They're looking for eye contact, and they're also simple questions like, what round are you in? Where are we right now? Like it could be something as simple as that, because you're looking to see if they're suffering from any cognitive impairments, right? If they're not in there, if they're not in the fight mentally, cognitively, that is an indication that they could be suffering a concussion. And the other thing too, we're going to get into these later, but there's also red flags that need to be identified, because those red flags could be indications of there being much greater brain trauma, moderate to severe brain traumas, brain bleeds, those sorts of things that is going to send them to the hospital immediately. So there's, in terms of the suspensions, the guidelines that they set out, for example, if there's a TKO, secondary to blows to the head, the recommendation is that they're out for a minimum of 30 days. So they're not allowed to compete for 30 days. If they should also refrain from sparring for 30 days. If there is a KO without loss of consciousness, it's 60 days. KO with loss of consciousness, 90 days. So these seem like they're long, like protracted periods of time. But it's for the safety of the athlete. And then, we could talk about how, the UFC actually has come up with very detailed and very strategic guidelines on how the athlete can get back to competition. We'll touch on those shortly, because they've done, for anybody who's interested in checking it out, go online, look up the UFC's concussion and injury management protocols that they put out. It's actually section 44 and 45 of the guideline that they set out, and it's a great structured program for athletes to follow if you're in mixed martial arts, or even combat sports like boxing and Muay Thai. Yeah.
Guys, you know what? I also wanted to say, in terms of when they do, when they chalk, the refs grab the fighter's hands. It's like they're doing a quick neurological assessment just to see if they're alert and oriented. If there's a quick daze in their eyes. It's something that we do in the hospital setting as well. But you know what? It's tough on the refs as well, because you've seen fights where fighters are like, "Hey man, what's going on? Like, what's happening here? How come you're stopping the fight so early?" And there's instances even with Herb. Like Herb Dean, I feel like he gets a blunt end of it, because he's always just like, "What are you doing?" And why are you stopping early? And fans are always just like, "Hey, let him fight." But he has to make a decision as well. Yeah, so big shout outs to the refs that's out there as well. That's that have to make those calls, because again, they want to protect their fighters and they want to make sure everyone is safe. Safety is the most important fight. That's what they're there to do, right? So
And that's and sorry, Jim, and that's the thing too, right? Is that in boxing, people will get hit in the head, then they go down, they get an 8 count, they stand up, the ref checks them. Like, you're giving them that little bit of time, and then the ref has a stopped, paused moment to be able to make that assessment. Whereas in MMA, the ref is doing it on the fly. Like, he has to look at you as you're getting hit, as you're dodging, as you're moving, and trying to quickly make those assessments. And that's why sometimes the ref makes the call. The guy, maybe is okay, but the ref is like, I don't know, man. In that brief instant, in a moment, I'm seeing that there's a problem there. I'm seeing the eyes glaze back. I'm seeing something go on, and they've got to make that call, But then you see some fighters that, and then if you remember Carla Esparza, when she lost the title to Joanna, that was one of the most crazy ones, because she was standing up and just taking a beating, and it was going on a long time. And then finally the ref stops it. And I remember she was standing there taking it, right? Mm-hmm. And it looked like she was in the fight, not in the fight, but she's standing. The minute the ref called it off, she slumped into the ref's arms. So that was that moment where you're like, holy cow, there's an athlete who is too good, right? Too strong for her own good. She's sitting there. She's willing to stay in that fight, even though she is gone. Yeah. And then when the ref finally goes, okay, wait, I see that she's not intelligently defending herself. I have to call this fight. And he calls it, and she just slumps. You're like, yeah, that's the body saying, okay, thank you. I'm out of here, right?
That's right. It's a lot like what happened with Wilder Fury too, where, just touching on what you said, Prince, the referees have to be given a lot of credit for making these calls. The coaches as well. One of the coaches on Wilder's team threw the towel in because he saw that his athlete was getting beaten and he needed to protect him. As much as Wilder was like, I'm willing to die on my shield, and a lot of these athletes are they have that sort of warrior mentality, because that's really what all these people are that compete in these sports. They're warriors, but you don't want to lose someone because of their pride, right? And so even the coaches need to be rewarded for making those sorts of calls, even if it's an unpleasant call or the athlete disagrees. They're in a position to make that decision to keep their athletes safe.
Yeah, for sure. Mm-hmm. And Jim, I'm going to say a little short story here. I remember when we were training MMA at P4P in Markham, our coach at the time was Sean Pearson, UFC veteran, Sean the Punisher Pearson, or Sean the Pimp Pearson, depending if you go by his old nickname. And we had, a handful of people that would do MMA class. And some guys were a little bit hard, right? And we had these young kids come in and join us for a few weeks in a row. And they were young high school kids, maybe grade 9, maybe grade 10, and not serious martial artists, not even serious CrossFit people, right? Like not even serious like weekend jog people. They were just like young kids that wanted to do the class. And at the end of the classes, we would always do sparring. And so he would partner us up, and the young kids were all kind of partnering with themselves, of course, right? Because they were, equal skill. And then at some point we kept changing. And then I remember Sean going, okay, let's change. A couple of you can come out here, and we're going to send a few in there. And then he looks around and he goes, okay, Tim, you get in there and go spar with those kids, okay? And I was like, yeah, okay, whatever. And then as I'm going in, I remember he whispers to me, he goes, I can't trust some of these guys to not knock those kids out. And I was like, yeah, because, but even he knew, right? Like, you got to, and that's another thing I want to say, when you're sparring with people and whatever, you have to think about the level of yourself and the person you're sparring with, because you may be of a certain level, but if they are of a lower level or a much lower level, you don't realize how quickly you can catch them or how badly you could hurt them. And that's where, like, even the coaches, like you're saying, I mean, that's in the case of a fight, but this is in training, but the coaches have to be careful and be like, whoa, like, who am I putting against one another here? And are we going to make sure it's a safe environment for them? Yeah,
you can arguably say the opposite too, because the more inexperienced someone is, the more inexperienced they are in knowing how to spar. They're going to go in there and try and throw, haymakers, and you're also more likely to suffer injury at the hands of someone who goes in there with something to prove maybe to themselves, because they don't understand the nuances of sparring. So so I think it was a great move by your coach to put you in there, because someone who has a more experience can help, on the fly, educate these young guys on how to spar. It's a safety thing for you, but it's also a safety thing for them.
Yeah. Hey guys, you know what? I'll throw my little two-bit as well, because I mean, going, jeez, where do I start? But you know what? Going in there when it comes to sparring, like for me, I'll do anything to win. And to me, if I have to cheat my way to victory, that's what I'll have to do. And Jim, and so there's some instances where we're in the middle of a clinch. What I like to do is a little helpful hints for anyone in there that's like looking in to take the first dub is making sure to bite into someone's back hairs. Some people have a tendency to have back hairs in the back. That's what I tend to go for, and that causes a lot of pain. And then they like to clench down, and then that's when you go to town. And then if anyone says, Prince, is he down? I'm like, I guess so. He's not getting back up. So that's what I like to do. And shout out to Sean also, Sean Pearson. I'll tell you something right now, guys. Sean, he actually really scares me, man. Like every time he scared me. Tim, I don't know if I told you this, but whenever he would come into the gym, and I was like, literally, when he'd call us to come in, I'd be the first one running in, because every time he comes in, everybody jump in. I'd automatically do some push-ups. He wouldn't even ask for it. I just do it just in case. So just in case Sean's watching this podcast, Sean, I was petrified of you, but you also pushed me. So I was constantly doing push-ups at home because I'd hear your voice in there somewhere. Go. So,
all right, Jim, we'll get back to why you are here. We apologize for the tangents that we go off and the horrible.
It's all relative. It's all connected.
Yeah. And the horrible advice we're giving children.
No, Tim, listen. For the reason why I throw this in there, because sometimes everyone's gonna be like, "Hey, you know what? Like, sometimes we don't need that professional advice. Sometimes we just need a knucklehead to come in here and give us something else." And I'm giving that side of the spectrum. Yeah. Am I right, okay. Dr. Jim? Am I right?
Yeah, sure. I love it. I think it's great. Fantastic.
Yeah. Dr. Jim just lost his license by saying yes. So that's not a good idea. Jim, so where are we at here in the presentation? Are we talking now about what those protocols are and like what those rules are to return?
One of the things I want to touch back on is in terms of just talking about the athlete in the ring. After the fight is over, winner or loser, you need to take them outside of the ring to a quiet, closed area like a locker room and go through the evaluation, the steps with them there as well. Because sometimes the distraction and the noise makes it difficult to complete that assessment. But it's the same thing in contact sports like hockey, football. If an athlete is believed to be concussed, they come right off the field, right off of the ice. They're taken to the back by the team physician and they go through a concussion screen with them. But they do the same thing with mixed martial art athletes and combat, like boxers, combat sport athletes like that, in order to evaluate them and make sure that there's no signs of concussion, but also those red flags. Those are the things that they need to rule out, because that could be sending an athlete to a hospital right away, getting a CT scan or an MRI to make sure that there isn't something else more nefarious going on.
Okay. And so what are some of those red flags, Jim?
So if anybody's familiar with it, there's a thing called the Glasgow Coma Scale, the GCS. It's a scale that identifies the level of someone's conscious awareness. So 15 is a normal score. Anything less than 15 indicates that there's something neurologically going on. So that's one thing you check out. If any indication of there being a skull fracture, that's an obvious one. Cerebral spinal fluid coming out of the nose or the ears. It's a yellowy, clear liquid that can be sometimes mistaken for, mucus from the nose. But any indications of that is also an indication that there could be a skull fracture, like a basilar skull fracture back here. If there's any post-traumatic seizures, if an athlete starts to seize after a strike, that's an indication, or that's a red flag. Vomiting after the head injury more than once. Pupillary abnormalities, so the physician or the athletic trainer would be able to check the pupillary reflexes, make sure that they're reacting equally on either side. So if you do check, like if you're to do a pupillary reflex test, this side's being, the light's flashing here, this one should be reacting the same way. If there's a disparity in size, that could be an indication that there's a brain injury. And increasing concussion, like the somatic symptoms we talked about, like the nausea, the vomiting, the dizziness, those sort of things. And a deteriorating mental status, that's another dangerous sign. That's another red flag. So if someone starts to seem like they're just not aware of their surroundings, their communication skills have suddenly start to deteriorate, those are all indications for why you'd want to send someone to the hospital. Those are the red flags you got to watch out for.
Okay.
Mm-hmm.
So, even for us, you're dropping these terms, Dr. Jim, and for anyone who's got decreased LOC, level of consciousness, anyone you hear, so in the hospital field, you hear GCS. So anyone's GCS is above 15, or anyone's GCS is below 5, they're in a coma. Technically, they're in a coma state, right? So
that's right.
Definitely, it's again. I find I spoke to actually. When I worked on, I still work on medical floor. I had a doctor that actually was a part of the fights. He was actually one of the ones that assessed the fighters, and he was like, "Prince, it was so cool because you get to watch the fight, and you're front, you're at the front, and you got front seats, and you're watching. But sometimes you see some of these, some of the injuries that they face, like during the fight itself. I mean, we've had fighters who've actually, have passed, unfortunately, due to strikes, especially in boxing in itself, right? So again, you're right, Jim. I mean, really keeping a close eye on this, level of consciousness, GCS scores, their ability to answer some of these questions is very important.
That's right.
Yeah.
Sorry, go on, Tim.
No, go ahead.
I was going to say that there are tools available that are online. There's actually programs that you can access or even print off, things that are assessment tools for concussion. So, for example, I got one here called the SCAT-5. So this is an example of an assessment tool that you can use to identify whether or not an athlete has a concussion. But an important thing to do in contact sport athletes and even combat sport athletes is to do a baseline evaluation of their concussion scores, because you can use that as a measure to see what their level of potential concussion is like post-fight, and then monitor that throughout their career. You see this in younger athletes that play hockey is a perfect example of this. They'll do like a baseline score, and then in any incidents of indications of concussion, they can use that to track any progression or increase in symptoms associated with concussion. It's just one of the many ways that you can follow up on the status of an athlete's condition to make sure that they're not progressively getting worse, and you have an objective score, an objective measure to do that.
Right, and you have a baseline to be able to compare it to, I guess, right? Because not
exactly.
Everybody's starting. That's interesting, because that's similar to, I know I've heard for drug testing that there's something called a biological passport. And I know that in some forms of drug testing, what they do is they take what they call a biological passport. They get the baseline of all your levels, so like your testosterone levels and things like that. And then because everybody's can be slightly different, and if they get your baseline level, then as you continue to compete, they keep checking it and they compare it back to your passport to be able to say, oh, okay, there's a slight elevation here or something like that. And if something seems out of whack, then they definitely know it's not just like, hey, you've got more testosterone than a normal person at a normal time. I remember we had Raquel Pennington on, And she was talking about how she actually has extremely low testosterone. And so again, so for someone like her, like she, for someone that has extremely low testosterone, you could almost take extra testosterone and perhaps not even trigger anything. But if you had that passport, that would do it, right? So
that's right. It sets that baseline, that biological baseline. So you know what their pre-status, like their pre-fight status is, or pre-career status even, Yeah. So you had mentioned before the return to play, return to fight protocols that are in place. So the Association of Ringside Physicians, their recommendations are 3 phases with 3 steps each. I'm not going to go into the specific details. There's also, I came across this interesting information, the Amateur Mixed Martial Arts Ontario Association. So there's actually a mixed martial arts organization in Ontario that utilizes a 6-step process for the return to fight. So there's they're all very similar to a lot of the contact sport protocols that are out there. And most of us will remember the movie that came out not long ago about the CTE injuries, the chronic traumatic encephalopathies. So those are the brain injuries that occur over protracted periods of time. And one of the reasons why this became so prominent was because contact sport athletes in the NFL, NFL players were developing a lot of these issues that started to, they start to investigate these in greater detail. So the NFL put together a very comprehensive guideline for return to sport for concussions. And we had mentioned just moments ago, the UFC has done the same thing. And they have, I think it's a very fantastic protocol that they've come up with for their athletes to return to sport. It's very concise and it's obviously very specific to mixed martial arts. And they've done a 5-phase, 5-stage return to sport. But every one of those stages has subsections. So if you'd like, I can go through some of those details. And I think it's a wonderful thing that they put together for their athletes, and not just for UFC fighters. We're talking like all mixed martial art athletes, all combat sport athletes. I think could follow this kind of a guideline.
Yeah, no, for sure, Jim. I mean, I know when we were prepping for this podcast, shocker, people are going to go, "What? You prepare for this garbage?" But we do. In your notes, Jim, which were very thorough, no, you did break down the 5. So if you can go through just a little bit, because I think it's important for people to know, like, we can say all we want to our viewers and listeners, like, hey, you should go check that out. But not everyone's going to go check it out, right? So give a little bit of a high level, like what those five things are, because again, if it's you at home and you're training and you're going through things and you think, hey, I've got knocked a little bit, maybe I should just take it easy for a second. I'm not a pro athlete. Maybe let me just give myself a little bit of time before I get back in there and pretend, and to perhaps save myself from some long-term injury. So what are some of those 5 things, Jim?
So the first stage is the initial recovery stage. So this is within the first 28 to 48 hours of symptom management. Old protocols used to be like, stay off of, don't do anything for the first week or don't do anything for the first month. They've actually shown in studies that abstaining from physical activity can actually exacerbate the condition. So returning to some physical activity initially is actually good for recovery. So again, 24 to 40 hour management, using Tylenol or acetaminophen for symptom relief. Don't use Advil or Motrin because they can actually lead to bleeds because they're slightly blood thinning. So if you have an athlete that has an undetected bleed in their head, like a slow bleed that's in their head, let's say, like a subdural hematoma, you don't want to exacerbate that potentially with just the use of something like an ibuprofen. So you do the mental and physical tests, make sure you get a lot of sleep, monitor those red flags, and then abstain from all mental concentration. No screen time. No, you're not sitting there playing Sudoku. You want to give your brain a rest. So that's the first stage.
What an old guy Jim is that he references Sudoku.
I've never played Sudoku once in my life. I have no idea how that works. It was like 0 to 9, and that's all I know.
Okay. But just so that people understand, because I know you said it quickly, Jim. Advil, because it's a blood thinner. So if you've got a bleed in the brain, what happens is if you take Advil, it thins your blood, and your blood isn't able to clot.
Exactly. So it could potentially.
So you don't want to take that.
Exactly.
But what you did say is you can take aspirin.
Tylenol, acetaminophen.
Tylenol
Yeah.
you can take, but not Advil. Okay.
That's right. So
Aspirin, aspirin, you don't take. Don't take aspirin.
Yeah, okay.
That is a blood thinner. That's like,
Yeah.
aspirin. Okay, so stage 2, the stage 2 is the no contact phase. So again, check daily symptoms using the SCAT-5 that we talked about. There's that example there. You look for you go through the mild symptom checklist. You go through that, make sure that's less than 3 out of, the list of symptoms that they include there. Do physical therapy on the types of concussions. And that's another thing. I didn't touch on this yet. The UFC has done an amazing job of breaking down the different types of concussions that exist. So there's concussions. We know that concussions exist, but they've gone so far as to identify the different versions, the different types. So you can have, I'll go through this quickly, vestibular, which would be like your proprioceptive, your balance system. So that could be a type. Anything that's affecting your vision, so the motor control of your eyes, that can happen. So cervicogenic, which means it's like you can get pain and symptoms coming from your neck. Migraine and headaches, some affecting mood, so that's another type of concussion, and then your cognitive concussion. So what this addresses here in stage 2 is that you treat for those specific types of concussion. So if you got someone who has vestibular symptoms from their concussion, you treat the vestibular problems. So it's a very good breakdown of how they have that organized. You do the post-exercise checklist because you're allowing them to do some physical activity, and you use a heart rate monitor if it's possible to do so you can make sure that they're keeping their heart rate low. Then in that stage, you have stage 2.1, and that's the aerobic training. So that's low intensity, 15 to 20 minutes, plus warm-up and cool-down. Keep the heart rate low, less than 70%, and the exercises are walking and cycling. So you want to keep the intensity level low. One thing about all of these stages is that you need to monitor the patient's or the athlete's progression through this. If at any point in time through these stages they start to regress, they start to develop symptoms again, they're back to the previous stage. You don't want to continue to push them through those stages because they may start to exhibit symptoms, which again, concussion symptoms can manifest days or weeks later. So going through the symptoms checklist, you're going to do the low intensity, then stage 2.2 is the moderate intensity, 15 to 30 minutes. Again, you're checking that heart rate, 70, 80%. Stage 2.3, low intensity drills. So then you can start to do light MMA drills, but no risk of head contact. You want to make sure you're excluding all of that. There's no drills that are in this stage, no wrestling drills, and 60 to 80% of maximum heart rate. So you want to make sure that they're not going beyond that point. If they make it through that stage, they move on to stage 3. So this is still no contact, but this is no contact level 2. You do the SCAT-5 checklist or whatever tool is that you're using. Symptoms checklist. You do the physical therapy again based on the type of concussion. So just like you did with the previous stage, but then you can go into strength training. So that's low intensity strength training, 50 to 75% of maximum repetitions. Again, checking the heart rate, making sure that you're not exceeding a certain level. And then you move on to 3.2, which is the moderate intensity. And you can see how all of these start to like gradually go up in intensity, right?
Right.
And then 3.3 is technical training, low, moderate intensity drills. So you're still keeping it no contact, 100% no contact to the head, light to moderate MMA related drills. And then you can check them, evaluate them to move on to the next stage, which is the moderate contact. And this is where you check the symptoms, you engage in interval training, so moderate to high intensity interval training. Then if you make it through that one, and again, the heart rate level can go up, you move on to strength training, which is high intensity. If you make it through stage 4.2, then you move on to the last one. This is the one that brings you to return to fight status, right? So you're able to engage.
So Jim, how long before we get to this stage?
It can literally be on a daily basis. Like you monitor the patient's condition throughout the stages, and if they don't exhibit any symptoms associated with concussion within those stages, then they can move on to the next stage.
Okay. So it could be as quick, like we could get to stage 5 within 5 days.
Unlikely within 5 days, but it can happen within a reasonable amount of time within weeks. But keep in mind, you're trying to keep the athlete out of any competitive like contact sparring for at least 30 days, according to what some of the other protocols are. And then the full contact stuff. So again, you're doing the SCAT-5 or whatever protocol tool that you're checking out. Then you go into the technical training, so moderate intensity MMA drills. Then you go into, after you pass that stage, the high intensity drills. And then the last stage is the actual return to sparring. So this is high intensity drills with moderate to high risk of head contact. You include an increased amount of drills that involve inversion. So rolling or flipping backwards, because that can put pressure on the neck, which can exacerbate symptoms. 100% level of intensity, and then you can start the sparring sessions. So start with 1 sparring session per week with no more than 3 rounds for 5 minutes. So then you can start to progress. And then the last element of that is add more rounds over the course of 4 weeks until you reach 2 full sparring sessions of 5 rounds in each session.
That's crazy.
It's a pretty detailed breakdown. Yeah.
Yeah. Like, I think it's so interesting. And I mean, for those, that are interested, look it up. Right. And then Dr. Jim was saying that, that UFC did a big study, and I think it was from 2017 to 19, right? They were saying they did 2 years worth of data collection to come up with this protocol. I mean,
that's right.
It's pretty intense, but it shows the severity and the concern that you need to have around concussions and head trauma and TBIs and things like that. Right.
That's right. And the level of commitment to their athletes. Like, this was something that they had, I think they incorporated something like 300-400 athletes into this study. And, it's important for them that they are able to keep their athletes safe. It's very, there's inherent risk in this type of sport. And you want to make sure that you're protecting people who are involved in this type of sport, because you don't want there to be long-term complications. Things like we had talked about before, the CTE, Parkinson's disease, which can manifest. If you remember Muhammad Ali, he had Parkinson's symptoms associated with repeated blows to the head as a pro boxer. So I think it's wonderful that they've created this this program, and specifically addressing the concussion management. I think this is an excellent piece that they put out there for the protection of their athletes.
Yeah, thanks, Jim.
And guys, actually, what I wanted to ask you guys: have you guys ever experienced a concussion? Both of you?
Not that I'm aware of. I've never. I mean, you can be concussed in soccer, and I've taken blows to the head in soccer, which I played a lot of as a kid, but never in any combat sport. Not that I can remember. However, I did play football in high school, so who knows? Maybe I took a couple of shots to the head, and I don't remember.
Yeah, maybe the not remembering is the symptom that you can't remember. So
exactly, that's it.
Yeah, I think I probably have, Prince. Like, I remember one time coming out of sparring, and I remember I threw up at my car. Only threw up the one time, and it could have been just because I probably took some bad shots to the stomach, probably ate something bad as well, right? So it could have been anything, but I remember that time, and I remember after I did that, I was like, whoa, I got to take a couple of weeks off, and just not knowing and not having the knowledge that Dr. Jim is dropping. But I knew, like, maybe I should just lay off for a little bit, and I did, and then never really had anything again. Not that I can remember. So, yeah. You, Prince?
Well, listen, I've been cut from every team that I've tried out for, so I mean, I guarantee you I've never experienced a concussion. Maybe
never made it.
Yeah, or maybe possibly when I got a participation ribbon, I was like, whoa, I got this. I actually get something out of this, and they're like, whoa, I may have experienced a concussion out of there. So
like your head jarred back and forth.
I was
so
like,
quickly
whoa, I got something. Like I got something out of this. Like actually showing up, and I showed it to my mom. She's like, "Yep, we're putting that on the fridge." So
and then the whole Princey D family in the crowd, boom too, and they all got a little bit of concussion too. So that was a tough time.
You know what, guys? Tim, that just brought me back to the one podcast with Bam. So anyone who hasn't seen the Bam podcast, I'd watch it because it's really interesting. Because Bam, out of finished sparring, all of a sudden started to feel abdo pain. He's like, oh man, maybe it's just something I ate, something off. Mm-hmm. And then him ended up being at the hospital. So that's kind of scary, right? So this is like something everyone has to keep an eye out for. So yeah, Jim, thanks for sharing all that information, man. Solid.
Yeah, my pleasure.
Yeah, man, we appreciate you coming on so much because like like we're calling you our resident injury expert, whenever something happens, whenever we see something, we're going to call you. We're going to ask you to come back on to talk about it because I think it's important. Like people see it and they don't really understand what's going on. I really appreciate how you talked about the doctors and the refs when they're taking a look, because then people can understand like, oh, what is this guy doing? Because a lot of times, mind you, sometimes the doctors do look kind of fraudulent because they kind of run in, they go boop, boop, with their light and then they walk off, right? Like, I'm not sure you did a full assessment there, but and sometimes even the commentators will make a joke, right? I know Joe Rogan sometimes is like, what the hell was that? So, but that is what they're looking for, and those are the things. So thanks, Jim. Thanks for coming.
No, my pleasure for sure. And I think it's for all the people that are watching your podcast, I think it's important that we all recognize that in these types of sports, in contact and combat sports, there are inherent risks. It's just the nature of the game that you play. But it's important to be, armed with at least a tiny bit of this kind of education so that for yourself, but also, again, for your buddies, your friends, the people that you're out there sparring with, or, maybe you have a good friend, or even yourself, you're yourself a high-level athlete. You need to protect you, and you need to protect the people that you're engaging in the sport with. So, whatever information I can bring out with you guys, and I'm happy to chat about you with this stuff, and impart a little bit of knowledge to your fans here. I'm happy to do that. And besides, I just like seeing your faces. Like we're still in the midst of this pandemic. I can't see you boys. So
one day soon we will do this where we're all together. And I do want to say, you're mentioning, Jim, that people are watching us. So Prince, where can people find us?
Definitely, you guys. So everyone, we can find us at Spotify, Fight Inside Podcast. You can find us at Instagram, Fight Onsite Podcast. YouTube, definitely watch our YouTube videos, guys, at Fight Onsite Podcast as well. And if you want to get on to the actual show, you can email us at fightinsidepod@gmail.com. Okay?
Yeah, definitely.
And Jim's actually our very own Sanjay Gupta. That's what it is. Like, Sanjay, what do we got? Okay, Prince, here we go. This is what we're going to work with. We're going to come back next week with more stuff. All right, here we go.
So, and I do want to say, Prince, our podcast is now on a list with, it's a website called the New York City Podcast Network. So our podcast just got on there. So that's pretty cool. So anybody that's listening to us from south of the border, hello and welcome to our show. I think we just got on last week, so people might have perhaps caught our last week's episode, but maybe this week might be their first. So welcome. We're an MMA based podcast, right? We talk about all things MMA. We try to have different guests on all the time. I do want to give a shout out because I know, Prince, I feel like you're drinking your smoothie again today.
Yes, I am.
Last week we had from Living Pharmacy, an awesome guest, the owner of Living Pharmacy, that came on. And so I do want to remind people that, you should be checking out their stuff. Go to her website and you can use the promo code FIGHT for 15% off and free samples that she's going to throw in. So definitely check that out. It's great stuff. Jimmy, we are going to go to our fight on site, and you're okay to stick around?
Of course. I'm not going anywhere.
Tim, he has to stick around. He's got to make the sound effects. Like, that's mandatory. Yes. Like, what are you talking about? Like, you're not getting away that easy. Last time it was really good. Like, you actually put some into it, Jim. Like, you were like,
oh yeah, I was feeling it. I felt like I was there, doing the striking, and it was just I was all in it. Yeah,
honestly, I was just trying to coordinate it with with the characters that I had. Like, you were putting so much up. Like, I could feel the follow through and the swing kicks.
All right. So today, and again, for all of our new viewers and listeners, at the end of every episode, we do something called Fight on Site. And this is where Prince and I normally pick two different fighters to go head to head in a fantasy matchup. And we post it on our Instagram story on Saturdays, where you can vote for the winner that you think should win that fight based on the criteria or whatever it is, or maybe just who you like more. Prince, last week, it was the battle of the Diaz brothers.
Yeah.
Prince picked Nate Diaz thinking it was a shoe-in. I picked Nick, and Nick blew it away. I won that one by a large margin. I think it was like 90% or something like that.
Okay, guys.
Right from the beginning, it was a slaughter.
Well, what do you think? What's the hypothesis? What do you think the reason why people picked Nick over Nate?
I don't know, man. People like Nick. I've never been like a crazy massive Nick fan. I love Nate. Nate is my guy.
Yeah.
But people, there's a lot of love for Nick, man. People love the old school Nick Diaz. Right, Jim? I think Jim's a Nick Diaz guy.
Jim, probably. What do you think? Why do I think I lost?
I think that there's some people who love the old school Nick Diaz. He had some amazing fights, man. Like he shows, just like Nate though. But this is the thing with the Diaz brothers. Those guys are as hard as solid, like concrete, man. Those guys are hard boys. So I don't know. Maybe people just like Nick better than Nate.
It's just he's just got that history. He's just got that vintage Diaz, right? Well, he's a fan. He's a fan favorite.
Or unless we finally have bots. We have bots on our podcast that are voting against me. Like, this is nonsense.
We do have our Instagram is full of messages from bots A lot of them being of the Russian variety. So we do. We have tons. Okay, so for this week's Fight on Site, Prince, who wants to go first?
I think, okay, you know what? I'll go first. I'll go first. Yeah, so
right.
I'll go first. So
hold on, Jim, in honor of you, we could have tied it in many ways for Jimmy, but we decided to do, because you are such a smart guy, we are doing the da-da-da-da. No, I messed that up. Boom! Education. I was gonna spell it wrong to be really funny, but so the Fight on Site Educate Edition, we're picking two fighters with a high degree of education, and we'll put those guys up against one another. So Prince, go ahead. Your pick is.
All right, guys. So the person I'm picking for today's Fight on Site Educated Edition. So I've got Chael Sonnen. So Chael Sonnen, basically, so with him, he's actually, what most people don't actually know is that he is armed with the Bachelor of Science degree in Sociology from the University of Oregon, and worked as a real estate brokerage prior to his MMA career. But yeah, so he's got a bachelor's degree in sociology. So so that's why when you see him on his podcast as well, very opinionated, he's got a lot of views, just, he's a very smart guy. So my pick is Sonnen. Oh my gosh, please let this guy win, please.
I mean, I feel like his name is Chael.
Oh, sorry. Sorry, guys. So again, English isn't my first language, so okay. I'm still trying to work things out. But yeah, so Sonnen, Chael
Sonnen, the bad guy. This guy is money on the mic. He is so funny. He's still so funny now. Like, I think it was just yesterday he was smashing John Jones on Instagram and just like tearing him apart. Still,
he's sharp. That guy is sharp.
He's brutal, man. He's very good.
The thing with Sonnen is just he is able to drop so much attention and so much media. He just draws it all in. He just knows how to pick at the other guy's strings, right? So so that's my guy. I'm hoping maybe he'll pop in here and just introduce the winner. Like one day it'll happen. And Jim, you might have to be here as well.
My pick for the Educated Edition is the very first guy that I knew was highly educated. And it was a bit of a story around who he was, like, as he was coming up and as he was fighting. The commentators would always talk about it. Like, it was a story that they kind of almost like wanted to sell because it kind of helped the image of MMA. And this guy is he vice president of ONE FC? But we're talking about none other than Rich Franklin. I mean, he was old school champ, right? He was, I guess, old school, new school. He was like right in that.
He was that bridge. Yeah, he was that bridge when Ultimate Fighter first came out, and he was the guy. What was he? Was it middleweight? Yeah, he was middleweight, right?
Middleweight.
Yeah. Yep. That's right.
And he always, and I remember Jim, our buddy Dave, he was in love with this guy. Like, this guy was his favorite. I always remember Rich Franklin would always come out with the brown and pink shorts. Like, that color combination was the weirdest color combination, but that was his shorts, man, the brown and pink. I couldn't find a good photo of the brown and pink shorts. But anyways, the story always around Rich Franklin was that he was a math teacher, that he had his bachelor's in mathematics. He was a high school teacher, and that he also had his master's in education as well. So he was a very highly educated individual. That's actually why he didn't even start into MMA until he was much older. I think he was 25, 26 when he started to get into it. But yeah, there's a long list of highly educated mixed martial artists. It's pretty interesting, right? Because you don't really think that, but then a lot of them do have that high education background. They've done a lot, work-wise, but career-wise. And so it's pretty cool because then they have that thing to fall back on. And I mean, Rich obviously is a super smart guy. That's why now he's, a VP of ONE FC, right, over in Japan. So it's pretty cool. Right. And when you watch those events, right, he's always on the mic and stuff like that. And he's very well spoken, very articulate, very well spoken. So he's a good guy, and that's our pick. So this is an old school battle, Chael versus Franklin.
See, I thought one of you guys were going to go even more old school. A Canadian boy, Carlos the Ronin Newton. I thought you guys were to go with him. That is a smart guy. He is one of my favorites from the old school, the vicious jiu-jitsu practitioner. But you're right. I think maybe because of the fact, like you said, we've got a lot of these athletes that are highly educated, a high level of education. It's got to be something in their genetic makeup too. It's got to be that competitive drive, right? They want to succeed. They want to do well academically, financially may be the case, but they have that competitive drive to push themselves. Because, MMA is an individual sport, right? It's like tennis. You're not playing on a team unless you're doing doubles, I guess. But, and academics is the same thing. It's not a team sport. It's an individual sport. So I think you guys picked two killers there, though. I mean,
I love be a good battle.
That is going to be a good battle. Yeah, that is going to be a great battle.
But man, to think about it, Rich Franklin, like bachelor's degree in mathematics, like who takes a specialty in that? What is he, a sociopath?
Maybe that's why you should have known he was a fighter. I mean, maybe go into that.
Oh, yeah, but you know what, Jay, I wanted to say too, like you make a really good point because it's almost like fighting and the competitive nature of it as well. And you know what, I think of there's another. I don't know if you've heard of Johnny Kim, and he's actually he's an astronaut. He's an astronaut / Navy SEAL / doctor.
Incredible.
He's got. I'm actually reading a biography on this guy, and it's crazy how he started off on these things. First, he was a Navy SEAL and saw how crazy it was in the battlefield, seeing some of his comrades get hit, and then all of a sudden he's like, you know what, I want to go and help out my team, and so he became a doctor, and now he's going to become an astronaut. So it's almost like the competitive nature and how it goes back and forth. I could barely tie my own shoes. So
another concussion symptom that we're drawing out of you, Prince.
That's it. I had to tape this thing on. I didn't even drill that thing on because me and a power drill just does not work together, right? So, So, well, listen, fight on site, guys. So you know what we got to do is we got to throw these two fighters in the fight simulator. And Jim is over there drinking his water, clearing his throat because you know what? It's game time, baby. So
let's do this.
That's it. So actually, you know what, Tim? I'll let you pick. Which one? Who do you want? Who do you want to be? Wolverine.
Okay. So we've got Wolverine
or Captain America.
Captain America. Well, only because we just watched Falcon and Winter Soldier, I'm going to go with Captain America.
There we go. Rich Franklin, we've got a Captain America, and we've got Sonnen for Wolverine. All right, Jim, let's go. Let's hear it.
Bow, bow, bow. Choo, 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 bow. Pew, pew, pew.
Yes.
Oh, my God.
Yes, here we go. Fight outside fans. Guys, we've got Wolverine. Sonnen's going to take it again. You know me. It's never biased. This fight simulator, I find it comes up with really true results. It's never skewed. So I honestly think that we've got something that's going to take this dub. I think it's time to come back into the winning streak again because I've been losing back to back. Unreal. Yeah. So Tim, how many losses have I gotten now?
I don't know, Prince. I would have liked to have done that math before, but I am no Rich Ace Franklin. Jimmy, I appreciate you coming on, buddy. Before we let you go, we do want to announce our guest for next week. Jim, I think you're going to like this one. Prince, I will give you the honors.
Oh my gosh, here we go.
Next week.
Next week, we have the one and only Mark Munoz.
Amazing.
You're not even going to say you're not even going to say his name, his nickname, which is a reference to your country?
Oh, sorry, the Filipino wrecking machine.
Yes.
Mark Munoz.
So, Jim, we have Mark Munoz coming on. He is going to be promoting his movie that he is the star of called Lumpia 2. So it's a movie that's going through film festivals now, but he's agreed to join us on this lovely podcast, and he's going to come in and talk about his movie, Lumpia 2.
That's fantastic. That's amazing. Congratulations, guys. It's growing. It's growing. I love what you guys are doing. I love that you guys are getting the fan base and everybody's tuning in because you guys have awesome content. I'm really proud of you boys.
Thanks, buddy. And we're happy to have guests like you. Jim, before we go, where can people find you if they wanted to reach out to you, if they wanted to find out more, if they wanted to talk to you, even for actual care, right?
Yeah. Look me up online. You can find me online. I don't have a website that I utilize. You'll find me on Rate MDs though. If you Google my name, you'll see me there with all my reviews. My contact info is there. But yeah, you guys give me if anybody has any questions, you want to give me a shout. You can email me, and I probably should have given this to you before. info@drstavrosrehab.com. So info@drstavrosrehab.com. So you will have any questions, shoot me an email, and I'm happy to help you out.
Awesome. Cool. We will definitely put that in the comment section of our YouTube. We'll also put the link back up to the Living Pharmacy in case people are interested in that. Do check out our past episodes. Somewhere around now, you're going to start seeing links show up on the YouTube screen that will show like some of our other episodes. So please do check them out if you haven't seen them already. Like, subscribe, follow. Jim, it was amazing to have you, buddy. We hope to have
Always
you back
a pleasure.
again.
Always a
Prince,
pleasure. I love being here, you guys.
Prince, anything you want to say before we go?
Again, guys, follow us, Spotify, Instagram, YouTube, Fight Inside Podcast. You want to get on this show, fightinsidepod@gmail.com. Again, Kuya Jim, thank you so much.
Love you
Thanks,
guys.
buddy.
Love
Have
you.
a good one, guys. Have a good
Take
one.
care.
See you.